Hi, I'm Eric, and today we're diving into something we all have in common, our hearts. Specifically, what puts our hearts at risk for cardiovascular disease, or CVD. Before we dive into the details, let's take a moment to understand what CVD actually is. Cardiovascular disease happens when the heart or blood vessels don't work the way they should. These problems are serious, but the good news is we can lower the risks. In this video, we'll talk about some of the main risk factors for CVD so you can take steps toward living a long and healthy life. Let's start with the factors we can't control: age and family history. As we get older, our risk goes up, especially after 45 for men and 55 for women. And if a close male relative had CVD before 55, or a female relative before 65, your risk is higher too. Aging is a natural part of life, so don't let that scare you. Use it as motivation to make better habits and live a healthier lifestyle. Now, while we can't change our age or family history, the good news is there are plenty of habits we can control. The first is smoking. It's no secret that smoking harms the lungs, but it also does serious damage to the heart. Even after quitting, the risk doesn't disappear right away, but the sooner you stop, the more your heart begins to heal. Every day without smoking is a step toward a stronger heart. Of course, smoking isn't the only habit that affects heart health. Another big one is physical inactivity. Our bodies are built to move, and they thrive when we do. But once we start slowing down and become more sedentary, our cardiovascular system begins to struggle. And I get it, we all live busy lives, whether we're grading papers after school or taking care of our own kids when we get home. But squeezing in some stretches, a quick run, or even a short body weight workout during the week can go a long way. Think of it as an investment. Your future self will thank you. So far, we've talked about habits we can see and feel. Now let's shift to the things happening inside our bodies, starting with blood sugar. Blood sugar gives us energy, but too much for too long is like a never-ending sugar rush. It can damage vital organs and raise your heart disease risk. Think of it like a classroom's energy level. A steady hum keeps things productive, but when the energy shoots too high for too long, chaos sets in, and nothing works the way it should. That's exactly what happens when blood sugar stays elevated. And speaking of what's happening in our blood, let's talk cholesterol. Cholesterol is a bit like hallways at school. HDL is the hallway monitor keeping the halls clear and safe, while LDL is the group of kids that clogs up the walkway and makes it hard to move. When LDL takes over, the halls get crowded and stressful, just like your arteries under pressure. The fix: eat more natural foods, stay active, and check your numbers regularly. Keep the good, manage the bad, and your heart will stay a lot happier. On to our next CVD risk factor, body mass index, or BMI. BMI is a quick way to estimate whether someone's weight may affect their health. It's calculated using height and weight, but it doesn't measure body fat directly, so it doesn't always give the full picture. Doctors usually use it as one tool among many to understand health, but it doesn't always define your overall well-being. And last but definitely not least, let's look at blood pressure. Blood pressure is the force of blood pushing against artery walls. High blood pressure often has no symptoms, but puts extra strain on the heart and other organs, leading to serious long-term effects. If you have a family history of high blood pressure or other risk factors, it's a good idea to check your blood pressure regularly. Stress can temporarily raise blood pressure, so don't worry if it's high once after the first day of school. Stay relaxed and follow medical guidelines for the most accurate results. So let's bring it all together. Some risk factors we can't control, like age and family history, but many we can influence, like moving more, quitting smoking, eating healthier, and keeping blood pressure and blood sugar in check. Your heart is the hardest working muscle you have, and it deserves more than coffee and stress to keep it going. Start with one small change this week, and you'll be giving your heart a big gift. Let's all do what we can to be healthy, be our best selves, and set a great example for the kids we serve. Thanks for watching.